Hello, everyone. Thanks for joining. I'm Piers MacNaughton. I lead the research initiatives at View Inc. And today we're going to talk about why it's important to invest in your human capital, that is your employees, and share some new research for the first time showing about what are the best investments to make in your employees. I'm joined by Kathryn Perry. She's the SVP at Independent Financial and Director of Healthy Communities. Kate and I met a while back. We both did our PhDs together at the Harvard School of Public Health. And the first thing we learned on day one in our program was around the social determinants of health. It's kind of the key concept within public health. And it basically states that our health is a function of four main factors: our genetics, our access to healthcare, our behaviors, and our environments. And so these are the four kind of main key factors that influence our health and wellness. Of those, we often obsess about our genetics and about access to healthcare. Those are the minority of what impacts our health. We're more influenced by our behaviors and our environments. You might have heard kind of the common refrain, which is that our zip code matters more than our genetic code. As an employer, we have a role to play as our corporate duty of care to improve health and wellness among our employees. And if you look at those social determinants of health, there are a couple of them that you can influence. Obviously, genetics, we don't want to and can't influence people's genetics. But for the other three, we do have levers that we can move with, obviously, our health insurance. We can provide health insurance to employees to give them access to healthcare. We provide wellness programs, which can help incentivize good behaviors and healthy behaviors. And then lastly, we provide physical space, office space that people can work in. But with the pandemic, our ability to move those levers has really been influenced negatively, in the sense that a lot of companies have had to resort to layoffs and furloughs, which can break people's access to that health insurance and care. We've not been able to provide the same level of access to wellness programs because it's had to move virtually. And then lastly, everyone's now working at home. And so you don't have that physical space to provide that healthy environment for people. And so I want to get Kate's perspective on this. She's someone who's taken a very active role within Independent Financial, looking at the health benefits that they can provide, and just get a sense of how you reacted to those challenges and what were some of the strategies you took during the pandemic to help promote those social determinants of health.
Yeah, at Independent Financial, we actually have stated our purpose as building strong, healthy communities. And we conceptualize this quite broadly, thinking about not just the physical and mental health, but financial stability, social connection, and purpose of our internal and external communities. These are the foundational things that people need to flourish in life. And so when the pandemic hit, our immediate efforts were, of course, focused on protecting the physical health and well-being of our employees. We took all the core actions that many of you also did, following CDC and other federal guidance. Our teams worked 50-50 schedules to de-densify our offices. Masks were required, as was social distancing. A lot of folks worked from home. We provided additional leave for COVID-related health and family needs, so that all of our employees would know that they have the time to get vaccinated and to stay home if they were sick. And then earlier this year, we put in place strong incentives for employee vaccination, and we ramped up those efforts pretty significantly this fall, with the goal of both protecting our employees as well as the larger communities where we all live, work, and play. And I think this orientation towards thinking broadly about health expanded the work that we did, because we were thinking about the social determinants that caused us to take some additional steps. So a couple of the things that are notable is, we avoided layoffs or furloughs. We know that supporting the financial stability of our workforce is key to their health as well as our business health. We supported our employees coping with changing life demands by expanding our policies with additional flexibility for family needs. And then, in addition to creating material stability and physical security, it was really important to step up our support for employees with social and emotional impacts of the pandemic. For most, if not all of us, the pandemic brought on a really intense period of uncertainty, change, and trauma. And what we did was offered a collaborative program called Mission Thrive. And over the past year and a half, hundreds of our employees have benefited from strategies and techniques presented to help them cope.
So I know another part of your strategy is that you make those decisions based off of data. And how do you go about figuring out what are the right strategies to even go after in the first place?
Yeah, that's a great question. There's most certainly a lot of noise and conjecture about what will happen post-pandemic. But there's also a lot of great data that can help us to start making sense of what's happening. And we've used a lot of the national data as well as local data to inform our decisions. And recently we completed an in-depth employee survey. It included feedback from over 1,100 of our employees. It's approximately 75% of our workforce. It included our corporate offices as well as our retail locations across Texas and Colorado. And we asked questions about employee engagement, work environment, and also health and well-being. And we saw this as a great opportunity for us to understand what was really happening rather than forming conclusions based on some of the broad assumptions floating around.
And I'm curious, what did you end up learning from this?
Well, we learned a lot. The first was there's still great value in shared office space. As much as the conversation nationally is about remote work, what we found is that our employees identified ideating, creating, collaborating, and relationship building with colleagues as key things that were supported with well-designed office spaces. And our employees broadly value access to this type of space.
When you talk about the office being better for ideation and these kind of offensive activities, what are some of the strategies that you took about the office space you have to help promote some of those outcomes?
Some of the strategies we've employed include flexible and adaptive workspaces, more space for collaboration, as well as greater variety of layouts in our offices, and importantly, views of outdoors, some balconies and patios. So people have a lot more variety and choice over their environment. And in our new headquarters, we prioritize many of these strategies, and it's having a significant impact on how our teams have responded to the space. The second finding from our study shows and expands upon how our employees value and prioritize our offerings as an employer. And this takeaway was that it's not only that our employees value great office environments. In the survey, key characteristics of healthy offices were valued more than any of the wellness programs we offer. And I'm really proud of the range of benefits we offer our employees. I feel like they're robust. But the survey results provided strong evidence to support that employees were prioritizing daylight in their work environment, views of nature, access to walking trails, and all of those things were ranked above third-party health and wellness resources. So anecdotally, I think you see this is somewhat reflected in the Great Resignation, where people are choosing work environments and locations that support their health and well-being in a much broader way than they had previously. And they're really carefully prioritizing how and where they spend their time. So people intuitively know when environment's good for them. And so when you meet these two conditions, creating space for shared value, collaboration, relationship building, and you ensure that that's great space and it's healthy for people to be in, that they want to be there.
And I mean, another key benefit that comes out of that is that, the physical workspace is really an all-in solution. It's there for everyone that goes to the office. Whereas, as you mentioned, some of those more programmatic activities require people to really opt in and go after those benefits themselves. And there's been a lot of research, even predating what we've done, showing that the people that tend to use those programs tend to be the ones that are healthier. And you don't always get great adoption. It doesn't always lead to the outcomes that you want. Although it is obviously an important part of having a balanced benefits program, it hasn't always shown to have the benefits. Whereas physical space, there's tons of research out there about how having access to good air quality, lighting, natural access to views, thermal comfort, these are all really well established to have an impact on our health and wellness. The second piece is that if you look at just from our own survey, the people that benefited the most were the ones that probably were the most disadvantaged within the company. People that maybe reported having less financial security were the ones that preferentially ranked the physical amenities over the wellness programs. And the same was true with gender, that female employees tended to have more of a preference for amenities than than some of those wellness programs. And so we're seeing that the office space and returning to the office can actually be something that can be used to bridge that equity gap and make it so that there's a lot more equitable access to that space for people to use.
Yeah, I couldn't agree more. And I think it's this third finding from our survey that is, to me, a critical takeaway. And it's not one that I see being discussed. We know from the research you cited, as well as a lot of the research around the pandemic, that health equity is far from being a reality. COVID-19 has unequally affected women, and as well as many racial and ethnic minority groups. And so when we see that our employees who score lower on measures of human flourishing are also highly valuing healthy office environments, it highlights this gap in that if we make decisions to move out of the office, we may be denying employees access to healthy spaces. And the reality is that not all employees have access to healthy spaces at home. And there's a wealth continuum there, right? Wealthier employees frequently have better at-home work environments than less well-off employees. So as we think about where we work and how we innovate going forward, it's imperative that we bear this in mind.
For sure. And, not just about the equity perspective, but also in terms of coming out of the pandemic, it's going to be a challenge to get people to return back to the office now that they've gotten used to sitting at home. They have their PJs on when they're doing their work calls. They're able to, set their thermostat to the temperature they like. They get to sit next to the window. Whereas in the office space, you often don't have that same ability to control your physical space. And so the kind of last thing we found from the survey together was that if you create a space that is healthy, people are much more inclined to come back to that space, to get excited to come back to work. In particular, as a company, you guys have really invested in your physical space, and you've developed this new headquarters facility, and now you're doing your second phase for all of your corporate employees, and you've really gone kind of all out to provide access to views through the View Smart windows, as well as having balconies and all these other amenities in the space that make it really a lovely space. In the survey, we found that the people that are working in that headquarters building have the most access to views and to nature, even more than, say, people in other locations, and that the closer you are to the better your view is. And not only that what really drives people's flourishing is their ability to have access to the things that they think are important, which is, being thermally comfortable, having good access to nature, having good air quality, feeling safe in the space, especially following the pandemic. These are all kind of critical factors that need to be considered to make the office space not just a place to work, but a place that really people want to come back to be back with their employees and their colleagues and working together again.
Mm-hmm. Definitely. I think as we emerge from the worst of the pandemic, our business leaders really have an opportunity as well as a responsibility to rethink how we can innovate to make our communities better, healthier, and more equitable places. And the role of the physical office is going to be a big piece of that. But so is how we interact with our employees when they work remote. From our end, our commitment is not only to address financial needs of those in our marketplace, but also the other conditions essential to improving opportunity, and as Piers mentioned, to human flourishing. So regardless of where they work, the health and well-being of our employees is a priority. This is embedded in our culture and is a critical piece of the success of our business. And as Piers, from your work on healthy buildings, investments in human capital produce a really strong ROI. So there's broad evidence to support this. The things people care about most are things like how a company treats its employees. You also see this reflected in the Great Resignation, with employees taking decisions to leave in part on how their employer treated them during the pandemic, what kind of environment they had. Employees who feel connected or embedded with their organizations are less likely to leave, and physical space can support building those relationships and positive experiences. And then healthy, flourishing employees are more productive and engaged. They have lower rates of absenteeism and presenteeism, and they contribute to a positive and virtuous cycle of health and wealth. So I'll leave you with this thought that businesses thrive when their employees and their communities thrive. And in a post-pandemic world, investments in health and well-being will be core to resilient business strategies.